There are professions in all domains that the Department of Education excluded from their pretty narrow list of 10. I mean, the healthcare field is already stretched so thin. Why make it harder for people to pursue these degrees that produced really vital healthcare team members?
What could certain medical fields losing professional degree status due to Trump's Big Beautiful Bill mean? As part of the Big Beautiful Bill, the Trump administration has decided that a range of degrees will no longer qualify as professional degrees, limiting the amount of federal student loans students are able to take out. This included nursing degrees, which sparked major media attention. However, decisions surrounding the bill excluded other graduate degrees. We sat down with a working physician assistant who works in a hospital in a major U.S. city and preferred to remain anonymous for this interview.
So there's a lot of variety in the PA profession, but in my particular role, I work with patients in a hospital setting. So I see them in the morning, they tell me about their symptoms, I perform a physical exam, I order diagnostics, so that could be lab work or imaging.
In response to the recent media buzz, the Trump administration released a myth versus fact page, stating that the coverage is misinformation, and that the administration has placed common sense limits on federal student loans for graduate degrees. In light of this, we asked our guest how she thinks the decision would affect the PA field.
So short answer, I guess, in my opinion, less people ultimately will apply, and there'll be a decrease in the workforce size. That could result in less access to healthcare for our patients and cause worse outcomes as a result of that. And for those who do apply and graduate from PA school, I mean, they'll have to suffer kind of the unforgiving nature of private loans or are either well off to begin with.
Our guest broke down the cost of PA school and what that means on a financial level for new students entering the field.
There's obviously variability, but on average, programs are about $75,000 to $100,000 in total, not including the cost of housing or food. So the average PA program is about 27 months long, and so that comes to about $33,000 to $44,000 a year. When I went to school, it was a huge weight off my shoulders just to know that the government funding would cover my loans and I wouldn't have to worry about that, and I could just focus on my studies without having to scramble to come up with money to cover the rest. But under this new law, PA students are going to have to supplement to cover, whatever's on top of the $20,500 that they can get from the government.
She also explained her concern that this decision will force students to turn to more private loans to make up for the funding no longer available through federal loans, raising worries about higher interest rates and stricter eligibility requirements that often rely heavily on one's credit score. However, the Trump administration claimed that rising school costs is the outcome of graduate and professional students being able to borrow up to the full cost of attendance, allowing universities to increase tuition rates. We also asked what the effects she believes this will have on the medical industry as a whole.
There are professions in all domains that the Department of Education excluded from their pretty narrow list of 10. Like you said, to name a few in medicine particularly, so obviously PAs, nurses, including nurse practitioners, physical therapists, social workers, audiologists. I mean, the healthcare field is already stretched so thin. Why make it harder for people to pursue these degrees that produced really vital healthcare team members? And if we do see fewer applicants from this change, it will just stress out our current workforce and lead to more burnout, which negatively impacts our patient care.
What do you think about the Trump administration's reclassification of professional degrees? Let us know in the comments.